Sulphur, a cornerstone remedy in homeopathy. Sulphur, a fundamental remedy in homeopathy, is derived from the element sulfur, a yellow, brittle, and crystalline substance commonly found near volcanic sites and hot springs. The preparation process involves triturating pure sulfur with lactose and then subjecting it to successive dilutions and succussions to create potentized remedies. This method ensures the removal of toxicity while preserving its therapeutic properties. Sulfur has been used historically in traditional medicine for its antiseptic, anti-inflammatory, and purifying qualities. It is deeply associated with the element of fire, symbolizing transformation and energy, and has a wide range of applications in homeopathy, from physical to psychological ailments. Sulfur's influence on the mind is profound, and it can be categorized into two primary personality types. These individuals are intellectual, inventive, and highly confident in their abilities. They possess a strong ego and may often be condescending, critical, or dismissive of others. This type of sulfur is driven by a passion for theoretical and abstract thinking, often becoming lost in their ideas. They can be detached from practical realities, neglecting personal hygiene and physical appearances. While still confident, this type is more grounded, dependable, and service-oriented. They seek approval from others and are often more socially inclined. However, they share a tendency for procrastination and laziness when their energy wanes. Self-assured, often to the point of arrogance. Critical of others and highly opinionated. A tendency toward procrastination despite a sharp mind. Inclination to laziness, particularly when detached from worldly concerns. Moments of deep despair, often linked to feelings of failure or rejection. Sulfur profoundly impacts the skin, gastrointestinal system, and metabolism. Common physical features include eczema, psoriasis, acne, and other chronic skin conditions. The eruptions are often moist, itchy, and aggravated by warmth and bathing. Profuse perspiration with a characteristic foul smell. Sulfur patients are often unbothered by their body odor, but find others' odors offensive. Burning sensations in the stomach and esophagus, a tendency for diarrhea in the morning, and strong cravings for sweets, spicy foods, and alcohol. Messy hair, stained clothing, and slovenly grooming habits. Intolerance to heat, often resulting in burning sensations on the soles of the feet, and an overwhelming desire to uncover the feet at night. Heat, particularly of the bed. Bathing or water exposure. Standing for long periods. Early mornings, diarrhea, weakness. Suppressed eruptions or discharges. Fresh, cool air. Dry weather. Rest and relaxation. Elevating the feet. Sulfur addresses a broad spectrum of physical and psychological conditions, including chronic eczema with redness, itching, and burning. Acne, boils, antiseptic. Fungal infections and ringworm. Acid reflux with burning pain. Diarrhea, especially early in the morning. Constipation with ineffectual urging. Asthma, bronchitis, and chronic cough. Aggravation from suppressed skin eruptions. Depression with self-loathing and hopelessness. Obsessive thinking and critical attitudes. Intellectual fatigue and detachment. Varicose veins and hemorrhoids. Sensations in the extremities. Calcarea carbonica, more suited for individuals with physical sluggishness, obesity, and cold intolerance, unlike sulfur's heat intolerance. Arsenicum album, shares burning sensations but focuses on anxiety, restlessness, and meticulous cleanliness. Poseranum, used for suppressed eruptions and similar skin complaints, but is more focused on despair and pessimism. Nux vomica, addresses digestive and nervous system complaints, but is more irritable and overworked. Low potencies, 6x, 30C, 9. Suitable for localized skin conditions and mild symptoms. Administer daily or weekly, depending on the severity. Medium potencies, 200C, Ideal for systemic conditions affecting the skin, digestion, or mental health. Use less frequently, often weekly or bi-weekly. High potencies, 1 mg and above. Reserved for chronic and constitutional cases. Administer under professional supervision due to the potential for strong reactions. Frequency and duration of use should always be tailored to the patient's condition and response to treatment. Sulfur's use dates back to ancient times when it was used as a purifying agent and an antiseptic. Its association with fire and transformation has made it a symbolic remedy in traditional medicine. Samuel Hahnemann, the founder of homeopathy, extensively studied and proved sulfur, placing it as one of the most important antipsoric remedies. Modern studies highlight its efficacy in chronic skin diseases, digestive complaints, and psychosomatic disorders. Sulfur is a cornerstone remedy in homeopathy, addressing a wide range of physical, mental, and emotional conditions. Its unique ability to treat chronic skin diseases, digestive issues, and deep-seated emotional imbalances makes it an indispensable tool in a homeopath's arsenal. By understanding its key traits, indications, and modalities, practitioners can effectively utilize sulfur to bring about profound healing and transformation. This remedy, symbolizing fire and purification, continues to be a beacon of therapeutic hope in both acute and chronic cases.